Welcome to our deep dive on buttock augmentation. Um, this procedure has seen a surge in popularity. It's almost doubled in just a few years.
It really has.
And, we're not just going to be scratching the surface here. We're going deep.
Absolutely.
You're going to understand not just what's involved, but the anatomy and the safety considerations, which is a big topic of discussion.
It's fascinating how this area of plastic surgery really requires a deep understanding of the anatomy. And, it's not just about aesthetics. It's about safety for the patient. And we need to understand the complexities to ensure good outcomes.
Yeah. So let's start with a brief overview of the techniques that are used. There are four main ones, right?
Yes.
We have fat grafting, which is what a lot of people know as the Brazilian butt lift.
Correct.
And we have implants.
Yes.
Autologous flaps,
Yeah.
and non-surgical fillers.
That's right.
So let's start with fat grafting. So this is where you're using the patient's own fat, harvested from other areas like the abdomen or thighs, to add volume to the buttocks.
Yeah.
And this is ideal for patients with mild to moderate lipodystrophy who have enough donor fat but may not be suitable for those with very low or very high BMI.
Correct. So they need to have enough fat to be a good candidate for fat grafting.
And for those that don't, there's the option of implants, right?
Exactly.
So implants are typically made of silicone.
Yes, it's correct.
And are specifically designed for buttock augmentation and provide a more predictable volume increase.
Yes, that's one of the main benefits.
Okay. And then we have the autologous flaps. Now, that sounds a lot more complex.
It is a bit more complex. Autologous flaps are really reserved for patients who have had massive weight loss
Okay.
and have significant buttock ptosis and deflation, so they need a lot more help than just adding volume. They also need lifting.
Got it.
So this involves using the patient's own tissue to lift and reshape the buttocks, often in conjunction with a body lift.
Yeah, makes sense. And then finally, we have the non-surgical augmentation using fillers. So this is, I imagine, for people who want a less invasive approach.
Exactly. So non-surgical augmentation uses injectable fillers like hyaluronic acid to add volume to the buttocks. It's temporary, though it's not permanent, so you'd have to have that repeated.
Yeah. But it's less invasive than surgery.
It is, but it's very important to remember that permanent filler should never be used for buttock augmentation.
Oh, okay. So we'll definitely dive into that a little bit later.
Yes, absolutely.
Now, you mentioned earlier that anatomy is crucial.
It is.
So let's delve a little deeper into the anatomy of the buttock. The buttock is a layered structure, right?
It is. It's a very complex area, and it's crucial to understand those layers. The skin, the subcutaneous tissue, the muscle, and the bone.
Right.
And within those layers, we have a very important network of blood vessels and nerves that are really critical to avoid during surgery.
And knowing where they lie is essential to avoid complications.
Absolutely. For example, the superior gluteal artery and inferior gluteal artery are the main blood suppliers to the area.
Right.
And surgeons will use landmarks like the piriformis muscle to approximate their location.
To make sure that they don't damage them.
Exactly. We don't want to hit those.
What about the nerves?
Well, you're right. The superior and inferior gluteal nerves, and most importantly, the sciatic nerve, run through the buttock region.
And the sciatic nerve is the one that, if it gets damaged, can lead to some pretty serious complications.
Yes.
Yeah.
That's the one that can lead to significant problems with leg movement and sensation.
So yeah, that's definitely something you want to avoid.
Absolutely.
And it highlights the need for precision and expertise when performing this type of surgery.
Definitely.
Now let's move on to the aesthetics, because it's not just about size, it's about shape as well.
That's very true.
So how do you assess the buttock region in terms of aesthetics?
Well, we analyze the buttock region in terms of aesthetic subunits. These are like zones that we use to plan the procedure. And these subunits include the presacral area, the flanks, the lower back, and different parts of the buttock itself.
So you're considering the whole region, not just the buttocks in isolation.
Exactly. We're trying to create harmony.
A harmonious, balanced look.
That's right.
And what about the buttock itself? What kind of shapes are we talking about?
Well, within the buttock itself, we consider the overall shape. And this can be categorized as square, A-shape, V-shape, or round, based on the proportions of the hips, thighs, and buttocks.
Wow. So there's a lot to consider.
There is.
You take into account the individual's existing anatomy to determine the best approach.
Absolutely.
And what about buttock height? Is that something that you look at?
Yes. Buttock height is also very important. That's the distance from the top of the gluteus maximus muscle to the infragluteal fold.
Okay.
And the height of the buttock influences the overall aesthetic outcome as well.
Now, I'm curious, is there like a universally accepted ideal buttock?
Well, there are certain features that are generally considered desirable, but it's important to acknowledge that beauty really varies across cultures.
Of course.
And what might be considered ideal in one culture may not be in another.
So it's subjective.
Very much so.
But are there any, like, general features that are considered more desirable?
Well, generally speaking, a waist-to-hip ratio of 0.7 is often seen as desirable.
Oh,
A short infragluteal fold and a 45-degree lumbar curvature. But again, these are just general preferences and can vary.
yeah. So let's dive deeper into each of the augmentation techniques, and I think we should start with fat grafting.
Okay, sounds good.
So as you mentioned, fat grafting involves taking the fat from a donor area and injecting it into the buttocks. It's really good for addressing that lateral third of the buttock, an area that's harder to reach with implants.
That's right.
And I've heard of a technique called expansion vibration lipofilling. What can you tell me about that?
So expansion vibration lipofilling allows us to do large volume fat grafting
Okay.
by expanding the recipient area while simultaneously filling it with fat.
Oh, wow.
So it's a way of getting a lot of fat in there.
So that could potentially improve the fat survival.
Potentially, yes.
Now, what about fat survival? What are the factors that influence how much of the fat stays put?
So fat revascularization is key. The transferred fat needs to establish a new blood supply
Oh,
to survive. And several factors influence that, including the quality of the harvested fat,
right.
the injection technique, and the recipient site's ability to accept the fat.
So you don't want to overfill an area
Exactly. Overfilling can actually reduce fat survival.
because it compromises the blood flow.
Exactly.
So finding that sweet spot, that right balance is important.
Yes, that's key.
Now, are there any signs during the procedure that the surgeon would look for to indicate that they've reached that maximum fill volume?
Yes, there are some signs. If the surgeon feels a loss of resistance while injecting, or if there's continuous fat drainage from the injection site,
Okay.
that might signal that the maximum fill volume has been reached.
So it's important to be aware of those signs.
Absolutely. Always paying attention.
Now let's talk about potential complications.
Yeah.
What are some of the most common ones associated with fat grafting?
Well, like any surgery, fat grafting carries risks, even though it's generally considered safe. Common complications include seroma, which is fluid buildup, undercorrection, infection, pain, sciatic nerve symptoms, and fat necrosis.
Are there any complications that are, like, particularly concerning?
Yes, there are two that stand out. One is pulmonary fat embolism,
Okay.
and the other, unfortunately, is the risk of death.
Death from fat grafting.
It is a rare but serious risk, and it's important to understand that fat grafting has the highest mortality rate of any aesthetic surgery.
Wow.
And death can occur even when the injected volume isn't considered excessive.
That's concerning. What causes pulmonary fat embolism?
So traditionally, it was thought to be caused by direct cannula penetration of gluteal vessels during fat injection.
Okay.
However, we've been seeing pulmonary fat embolism even without deep intramuscular injection,
Really?
which has led to the deep intramuscular migration theory,
Okay.
which suggests that even when injected subfascially, fat can migrate
I see.
and potentially cause tears in the gluteal veins, allowing fat to enter the bloodstream.
So even with careful technique, there's still that potential
There is.
for the fat to reach dangerous areas.
That's right.
Given these risks, then, what can be done to make fat grafting safer?
Well, adhering to strict safety guidelines is absolutely crucial.
Okay.
The main one is fat should never be injected subfascially or intramuscularly.
Okay.
Only subcutaneous placement is acceptable.
Got it.
Other safety measures include using a larger cannula, avoiding downward angulation when injecting,
Okay.
careful patient positioning, and of course, thorough discussion of the risks with the patient.
Right. Informed consent is crucial.
Absolutely.
So these safety measures really emphasize the need for surgeons to be meticulous and prioritize patient safety above all else.
Absolutely no cutting corners.
Now let's shift gears and talk about implant-based buttock augmentation.
Sure.
So implant-based augmentation uses silicone implants to add volume primarily to the medial two-thirds of the buttock.
That's correct.
And this makes it a good option for patients who don't have enough fat for grafting.
Exactly. They can still achieve their desired results.
Now, I remember reading that initially breast implants were used. Is that still the case?
Well, that was the case many years ago, but now we have FDA-approved soft, solid silicone implants specifically designed for buttock augmentation.
Okay, so they're designed just for that area.
Yes.
And they're available in both smooth and textured forms.
Yes, that's right.
So how do you go about choosing the right implant for a patient?
Implant selection is critical. And we consider factors like the patient's anatomy, their desired projection, and their existing buttock shape.
Okay.
So choosing the right size and shape is really crucial to achieving a natural-looking result.
And what about the shapes? Are they all the same?
No, we have both round and oval implants.
Okay.
Round implants are typically better for shorter buttocks,
Got it.
while oval implants are more suitable for longer buttocks. However, oval implants do have a higher risk of malrotation.
So each shape has its own set of considerations.
Yes, exactly. It depends on the individual.
Now, are there any specific criteria for patients considering implant-based augmentation?
Yes, ideal candidates for implant-based augmentation should have stable weight,
Okay.
enough soft tissue to accommodate the implant,
Right.
and realistic expectations.
Of course.
It's important to understand that while implants can improve mild buttock ptosis, more significant ptosis might require an additional lift procedure.
Okay, so it might not address all concerns.
Not always. No.
Now, let's talk about the actual surgical procedure itself. How are these implants placed?
So there are two main incision options.
Okay.
A single midline incision within the gluteal cleft, or two separate parasacral incisions.
And then where do you actually place the implant within the buttock?
So the implant can be placed either in an intramuscular pocket, meaning within the gluteus maximus muscle,
Right.
or in a subfacial pocket, which is on top of the gluteus maximus fascia.
And each of those options has its pros and cons, I imagine.
They do. Intramuscular placement can make the implant less palpable, but carries a higher risk of sciatic nerve irritation. While subfacial placement allows for better lower buttock projection, but might make the implant more noticeable.
So it's a trade-off.
In a way, yeah.
Are there any other pocket options that are used?
Subcutaneous and submuscular pockets have been described, but they're rarely used today due to high complication rates.
They've fallen out of favor.
Yes, for the most part.
And now let's talk about complications associated with implant-based augmentation. What are some of the ones that patients need to be aware of?
So the most common complications with implant-based augmentation include wound dehiscence, seroma, infection, hematoma, and sciatic nerve symptoms.
Okay.
And then you can also have implant-specific complications like palpability, asymmetry, and capsular contracture.
So there are things to consider both in terms of the surgery itself and the long-term behavior of the implant.
Exactly, and that's why follow-up is so important.
Now, is it possible to combine implants with fat grafting?
Yes, absolutely.
And what would be the benefit of that?
This hybrid approach offers the benefits of both techniques. The implant provides that base volume, while fat grafting refines the shape and addresses specific areas that the implant alone might not be able to correct.
So it's like a more comprehensive approach.
Yes, you could say that.
And can potentially lead to a more aesthetically pleasing result.
In many cases, yes. By combining the two, we can achieve those really refined and natural-looking results.
This has been a very informative discussion on fat grafting and implant-based buttock augmentation. I think we should take a break here, and in part 2 of our deep dive, we'll continue our exploration into flap-based augmentation and non-surgical options.
Sounds good. Let's move on to flap-based auto-augmentation.
Okay.
This technique is particularly relevant for patients who've undergone massive weight loss and are experiencing, significant buttock ptosis and deflation.
You mentioned earlier that traditional excisional lifts often worsen the problem of lost projection.
Yeah.
Why is that?
Well, you see, traditional lifts focus primarily on removing excess skin and tightening the remaining tissue. And while this can improve lift and contour, it doesn't address the volume loss.
Right.
And can sometimes even make that appearance of flattening or lack of projection worse.
I see. So it's like you're tailoring a garment that's too big.
Exactly.
But you're not actually creating the right shape.
That's a good analogy.
So flat-based techniques offer a way to kind of redistribute and reshape the existing tissue.
That's right.
To create a more youthful and aesthetically pleasing contour.
Exactly. And we're restoring both lift and projection.
And these procedures are typically performed in conjunction with a body lift.
Yes, to address the overall excess skin and tissue.
Okay, that makes sense. What types of flaps are used for this type of augmentation?
Well, there are a variety of local flaps that can be used, including dermal fat flaps, superior gluteal artery perforator flaps.
Wow, these are some very specific terms.
Oh, yeah.
What else?
Split gluteal muscle flaps, island fat flaps, and purse string gluteoplasty.
So the choice of flap really depends on the individual patient's anatomy.
Yes, and the surgeon's expertise.
Of course. How do the complication rates of flap-based augmentation compare to fat grafting and implants?
That's a good question. Interestingly, flap-based augmentation doesn't seem to significantly impact overall complication rates
Okay.
in circumferential lower body contouring procedures.
So it's not necessarily adding more risk,
Yeah, it's not significantly, no.
but are there any specific complications that are more common with this technique or that surgeons pay close attention to?
Yes, the two primary concerns are wound dehiscence and fat necrosis.
And just to remind our listeners, wound dehiscence is when the incision opens up,
Right.
and fat necrosis is the death of fat cells,
Exactly.
which can lead to lumps and dimpling.
Yes, and contour irregularities.
So it seems like minimizing tension on the incisions, preventing infection, and ensuring good blood supply to those repositioned tissues are all crucial
Absolutely. Meticulous technique is key here.
for successful outcomes.
Yes, proper incision placement, tension-free closure, careful handling of the tissues, all of that is extremely important.
Now let's move on to non-surgical buttock augmentation,
Okay.
using injectable fillers. So how does this technique work, and what are its limitations?
Non-surgical augmentation involves injecting soft tissue fillers,
Okay.
like hyaluronic acid or
Ah.
polylactic acid, into the buttocks to add temporary volume.
So it's a less invasive option than surgery,
It is.
but the results are not permanent.
Correct. And achieving significant augmentation often requires large volumes of filler, which can be quite costly.
So it's a good option for those who want a temporary boost but aren't ready for surgery or maybe can't afford it.
Exactly. It can be a good stepping stone.
But it's important to remember, and you mentioned this earlier, that permanent fillers should never be used
Absolutely not.
for buttock augmentation.
Yeah.
Why is that? What's wrong with permanent fillers?
The use of non-medical grade permanent fillers like silicone is extremely dangerous and can lead to severe, often irreversible complications.
Wow.
These complications can include infection, ulceration, granuloma formation, and asymmetry.
So you're talking about permanently deforming the buttocks.
Yes, it can be really devastating for the patient.
It sounds like the risks associated with these permanent fillers far outweigh any potential benefits.
They do. The potential for severe and irreversible complications makes their use unacceptable in buttock augmentation.
And are these permanent fillers still being used in some places?
Unfortunately, yes. We do see reports of their use, often by unlicensed providers, particularly in the context of cosmetic tourism.
So it's like a buyer beware situation.
Exactly.
You really need to do your research and choose a qualified provider.
Absolutely. Patient safety should always be the top priority.
Now that we've covered all four main techniques for buttock augmentation, fat grafting, implants, autologous flaps, and non-surgical fillers, let's kind of step back and consider the factors that influence the choice of which technique is most appropriate for each patient.
Okay, sure.
So there's no one-size-fits-all answer, is there?
No, not at all.
Each technique has its own strengths and limitations.
Exactly. What might be ideal for one patient might not be suitable for another.
Can you give us some examples of how those factors might influence the decision?
Sure. Let's say you have a patient with significant buttock ptosis and volume loss after massive weight loss. This patient would likely benefit most from a flat-based auto-augmentation
Okay.
because it addresses both lift and volume simultaneously.
Makes sense.
Whereas a patient with good skin elasticity and sufficient donor fat, who primarily wants to enhance size and shape, might be a better candidate for fat grafting.
Right, so matching the technique to the specific problem and desired outcome.
Exactly.
And for someone who doesn't have enough donor fat but desires a more permanent solution than fillers, implants might be the way to go.
Right.
It sounds like a thorough consultation with a qualified and experienced surgeon is really essential
Oh, absolutely. It's crucial.
for navigating these decisions.
A comprehensive discussion about the risks and benefits of each approach, tailored to the individual patient, that's paramount.
For making informed choices.
Yes, informed consent is key.
We've covered a lot of ground in this deep dive into buttock augmentation, exploring the anatomy, the techniques, the potential risks, and complications.
We have.
As we wrap up this exploration, what key takeaways would you like our listeners to remember?
It's really important to remember that buttock augmentation is a complex procedure.
Yes.
It's not just about achieving a certain aesthetic. It's about approaching these procedures with a deep understanding of the anatomy,
Right.
the potential risks and benefits, and really prioritizing patient safety above all else.
We talked about four main techniques:
Right,
fat grafting, implants, autologous flaps, and non-surgical fillers.
right.
and each has its own advantages and disadvantages, ideal patient profiles, and potential complications.
For fat grafting, meticulous technique and adherence to safety guidelines is crucial to minimize the risks like pulmonary fat embolism and fat necrosis.
Absolutely.
For implants, choosing the right size and shape is paramount to avoid complications like implant malposition or capsular contracture.
And for patients who've undergone massive weight loss, flat-based auto-augmentation offers a way to restore both lift and projection.
Yes, but it's important to remember that wound dehiscence and fat necrosis are still potential concerns.
And non-surgical augmentation with temporary fillers can be an option.
Yes, but permanent fillers are never appropriate
Why?
due to that high risk of serious complications.
It's been a fascinating deep dive into the world of buttock augmentation.
It has.
And I want to thank you for sharing your expertise with us today.
It was my pleasure.
This deep dive has provided valuable insights into the complexities and considerations involved in buttock augmentation.
I hope so.
And we hope this information empowers our listeners to make informed decisions about their own body and aesthetic goals.
Absolutely, that's the goal. It's really important to remember that buttock augmentation is a complex procedure. It's not just about achieving a certain aesthetic. It's about approaching these procedures with a deep understanding of the anatomy, the potential risks and benefits, and really prioritizing patient safety above all else.